More than 2,500 Arizonans are in hospitals across the state tonight with COVID-19. This latest surge comes as the healthcare community is trying to rally to be there for patients, but many healthcare workers are feeling burned out. News 4 Tucson's Eric Fink spoke to one therapist who spent more than a year on the front lines, but recently left the critical care setting in the hospital. He joins us now with the story. Eric?
And Sean, this respiratory therapist says she got to the point this summer where she badly needed a change after the stress of her job simply became too much. This after she had been on the front lines battling the coronavirus in several hospitals across multiple states.
I'm so burned out, like so many other people, that I got to a point where I physically could not do the job anymore because of the mental cost.
At the start of the pandemic, respiratory therapist Amy Burke went to New York, then the epicenter of the virus in the U.S., and fought COVID's wrath every day. She took the battle back home to Arizona for another year. At the end of June, she just couldn't do it anymore.
I saw well over 1,000 people die by themselves without their family members. And it just never felt like it was going to end. And I developed post-traumatic stress disorder, and I became suicidal.
Amy's story is not unique. This latest COVID surge comes with a shortage of healthcare professionals. For a time Tuesday, Pima County had only 11 open ICU beds, and bed availability often depends on staffing.
The amount of trauma I think that the clinical workforce has experienced in the past 18 months has been relentless. Many people, Eric, have left the workforce.
Amy now works as a therapist for a home health care company. She says she's happier, but she still struggles with her decision to leave the hospital.
I have friends that I was in New York with who are still going around and chasing all the hot spots with COVID, and I have a tremendous amount of guilt for not going too. Right. But I also have a family, and I need to be there for them.
And with this latest COVID surge, Dr. Collins says many hospitals in Pima County have requested more nurses to join their teams as bed capacity dwindles. Collins says the federal government is scurrying to make that happen, but with a shortage of nurses, respiratory therapists, and doctors, right now that's no easy task. I'm Eric Fink, News 4 Tucson.